I'm really honored and proud to present for the 2025 Interdisciplinary Geriatric Case Competition. So just to start us out, to outline Ms. Staples' case conceptualization, we're going to start with the patient overview and then go into the case overview, introduce our team, talk about some barriers, go through our plan of care, and then end with our conclusion with our goals. And so at the forefront of this model is Miss Carla Staple. And so I organized this section to talk about her background history. So just to start, she's a 79-year-old African-American female who trained as an LPN after high school and served in the military, providing care during the Vietnam War. She left the military due to a sustained injury and became a second-grade teacher. So who's all in her family? So there's a strong tradition of military service. At the forefront as a caretaker is her husband, Hank Staple, along with their 5 children, including Anthony and Janie, who are very involved in her care. In terms of her social history, she received support from her immediate family and close friends from church community. However, due to some environmental factors that we'll get into, she's facing social isolation and especially feeling like a burden of having others taking care of her. Economic and environmental, there was a flash flood in 1982 and then a flash flood currently, which led to being evacuated to a FEMA shelter. And there are barriers, including transportation and finances that we'll talk about later on. So our team was a big proponent of looking at things from a biopsychosocial view. And so in terms of her medical history, she has a below the leg amputation, along with several immune conditions and then cardiovascular risk factors. I talked about that flood, which led to displacement from the shelter and several barriers. Also, the VA clinic was damaged, which limits some access to care. In terms of her social history, Hank is her primary caretaker along with her children. However, she is facing symptoms of depression, including guilt, sadness, and frustration that we'll address later in our psychosocial view. And then I'm going to hand it off to Joseph to introduce our team.
Alrighty, thank you so much for the brief introduction and overview of our case. So far, I would like to take over and introduce our team. We were so blessed to have a team across different disciplines. We had people from dentistry, we have social work, we have physical therapists. We work together with a clinical neuropsychologist, but also with our team from medicine and from nursing, but also we work in partnership with our family, like Ms. Staples' family together, but also we included Georgie, who was also part of our team. Apart from that, we were able to outsource from other disciplines, and we were able to involve people from occupational therapists. We were able to work with the pharmacist, but as well, we were able to include nutritionists as part of our comprehensive team. Thank you. Let me hand over to Hannah. Yeah, so far our team were able to come out with the goal, and this we were able to prioritize Ms. Staples' safety, and that was number one, ensuring that we were able to install like grab bars for her so that she cannot fall, installing some detectors and some adequate lighting, but also we to take into consideration of the medication adherence. That was important part because we need to how to follow up the medications from the pharmacist review, but also we are able to promote emotional and well-being, linking her with the VA resources, but also encouraging participation with the church members. As well, we are able to focus on to enhance the physical function as like performing simple balance and to strength balance and also proper nutrition, like proper diet, but also follow up with the dental hygiene. All right, thank you. Let me hand over to Hannah.
So as Payton mentioned, there are barriers to care in this case. Some of these barriers include a lack of transportation and a lack to internet access. Living in a rural area, the flash flood that occurred and Miss Staples having a self-reliance attitude and not really wanting other people to help take care of her. And I'll hand it over to Amy to address these barriers further.
So yeah, so there are multiple barriers to Miss Staple receiving the medical care she needs. She will benefit from some transportation resources just to get to medical appointments. And especially after the flood, there are some options. Oates Transit, Missouri Department of Health and Senior Services, and the National Volunteer Transportation Center map could all be used as guides for services available near Miss Staple. And internet is another very important resource that she will need access to. She does prefer to attend telehealth appointments or receive care in the home. So there are many internet providers who may provide military discounts. And then the FCC does have the Lifeline program, which may provide free services after natural disasters just to keep members connected. So living in the rural community, Ms. Staple can utilize agencies. One, at the FEMA shelter where she's staying at. Another thing I would do as a social worker is maybe assist her with filling out like an application for Purina, who does often donate dog supplies, dog food to people during natural disasters, just knowing that Georgie is very important and could add some stress, just making sure that he is taken care of as well in the shelter he's at. And then also just familiarizing her with maybe local senior centers, so they can maybe provide referrals for Meals on Wheels to help with more nutritious meals. Also, they could participate in Call a Ride for transportation. That may be non-medical transport, but just in any place she needs to get to the store. And then just meeting with her as often as needed, at least weekly, just to help with any additional needs that she may have. And I think really, especially kind of going into maybe benefit from a referral to a chaplain. Salvation Army does provide some support services during natural disasters as well, both during and after. And then I can also assist Ms. Staple with maybe reaching out to some church members just to provide additional spiritual support for her. So one of the barriers to Ms. Staple getting the care she needs currently is that she only uses VA benefits, which really does mean that she has to be seen either at a VA clinic or ER or to a VA recommended facility. And those places sometimes do not have complete records of her medical history. I think with using the VA, and especially if we're thinking kind of longer term goals, maybe continued therapy, she would need to be seen at a clinic, a VA clinic or emergency room to be referred to those services. So, which can often take weeks. And so I think I would be able to assist her potentially with applying for Medicare to enhance the insurance benefits that she has available to her. And so, with Medicare enrollment, really what it means is there would be no gap in care. She would be able to receive services anywhere that she is. Although both insurances can't be billed for the same treatment, it would allow her to be seen in both community and VA settings, depending on the situation. And I think she really does prefer VA, but in this instance, she needs to be seen outside of the VA system. This does ensure no gaps in emergencies. Potentially ambulance services could be covered under Medicare as well. And then another concern we have is that she only has a 30-day supply of medications, and that she may not be able to go to the VA pharmacy to refill those. So being enrolled in a Medicare Part D does allow her to fill medications in community pharmacies, which does decrease the risk of missed doses.
Great. So the following plan of care outlines our way of strategies to address her emotional, physical, and social needs. And so I'm going to hand it off to Devon, who is our medical specialist on the team.
Hello. Hi. Yes. So I've divided up Ms. Staples' concerns into the immediate concern, the pain and redness at the site of her prosthetic, and then the rest of her conditions have been grouped up into those organ blocks you see there on the screen. So the first concern, the pain and the redness at the site of the prosthetic, she will need to be seen inpatient at a hospital to receive IV treatment. It's noted that she does prefer to be seen on an outpatient basis or at home, but given the comorbidities, there was history of fever, chills. She was having some trouble with some names earlier. I'm just concerned that the infection is a little bit more severe, so she'll need to be seen in a hospital. And when she's more stable, she can continue to receive those treatments on an outpatient basis. And she's also currently taking NSAIDs. I would like for her to switch that out with Tylenol, as chronic use of NSAIDs can lead to some stomach issues and ulcers. We don't want that for her. Okay, so it's noted that the effectiveness of the arthritis treatment is waning, and she's currently on azathioprine, and that's not first line for that. So I would like for her to switch that out with the methotrexate, and that should better resolve that issue. For the lupus, she can continue on the azathioprine, but that's for that, and no longer for the RA. Her blood pressure is still high, so I want to switch that to lisinopril. She's currently on amlodipine, and that can lead to some hyperplasia of the gums, and she has some issues right now with her mouth, and so I want to stay away from that. Also, her cholesterol is still high. She's on pravastatin, so I would like to change that out with atorvastatin. There's a longer half-life, and it's a little bit more potent, so hopefully that should bring her cholesterol levels down. She has a history of some situational grief, and I want for her to restart the sertraline until her living conditions are a little bit better. There's also a history of flashbacks to her time when she was in the war, so I'm thinking maybe there's some PTSD there. She's not having those flashbacks currently, but she's had them in the past. I want to get ahead of that, so I do want her to get set up with cognitive behavioral therapy. There's also been some hair and nail changes, so I want to make sure that she's properly counseled on diet as well to help those issues. So with those changes, there's a possibility of 7 drugs per day. That's a lot of medications per day. And given everything that's going on, I'm just concerned about polypharmacy. So I want for her to get connected with social work and nursing just to ensure compliance and organization. And with that, I believe we hand it off to nursing.
All right, thank you so much. So from the nursing perspective, I was able to plan her nursing care based on the immediate needs, like the previous prescribed the medicine. So at this particular moment, I should focus more on administering the medication as prescribed, monitoring body temperature, but also make sure that we prevent further infections. So the most important part here is just to implement pain and mobility support. She need to receive more education and advocacy, but also she need to be connected with the family and receive all the support from the friends and from the other people that she was in contact with. But also at this point, I should be able to revise her care of plan whenever some things are not working out, trying to revisit the cycle and make sure that everything is taken care of as immediately within 72 hours. Being a nurse, I have the role to make sure that patient voice is heard. So at this particular moment, I will be able to consult and work with other team members to make sure that Ms. Staples' condition is well taken care and well stabilized. Let me hand over to the nutritionist.
Excellent. So in terms of nutrition, something that is going to pose a little bit of a difficulty here is the flood that we experienced and the immediate shelter-based nutrition. Obviously limited here, but we want to make sure that in her case, we're prioritizing protein. We listed off a few options that might be available to her. Encouraging that high protein for her nutrition is going to be key, and then also implementing a hydration plan so that we're able to make sure she has those basic needs met. We're looking at like 6 cups of water a day is like a good target for her. And then in terms of just medical nutrition therapy adjustments that we could do that might help her, that are minimally invasive, we could, in terms of that rheumatoid arthritis and lupus, try to reduce any inflammatory foods she might have, so those refined sugars or fried foods, and encourage more omega-3 sources. And then to help her sustain better nutrition and incorporate that into the rest of her life, we obviously want to have some education and counseling so that she becomes interdependent, or she becomes independent and not relying on us for the long term of her life. And so we would help encourage that with these identifying lower sodium options for her, demonstrating some hydration cues since she's not getting enough water, and then encouraging those smaller meals or more frequent snacks, since she does talk about having a low appetite. And then in terms of her dental care, she had a few different concerns, a few different problems that were arising that we want to make sure we can address, that being the ill-fitting partial dentures, the jaw pain, and that could be arising from, as you can see, there are multiple different causes. And then we also want to just address the dental hygiene capabilities and access that she has. So the plan would be to first address her pain. You want to make sure that she becomes as comfortable as possible as soon as possible. So we would do an emergency appointment, trying to discover if it is periodontal disease, if it's a TMJ, if she's got caries, identifying that and taking the appropriate steps to free her from that disease or discomfort. And then we'll do a comprehensive cleaning and exam to see if she has any systemic issues that we need to address, as well as realigning those partial dentures for her so that she's able to carry out that nutrition plan and make sure she's getting all the food and meals appropriate for her. Education, we want to make sure that she's able to continue this for the rest of her life. One of those things that we want to make sure we're doing is obviously instructing her on the importance of the oral hygiene, but also equipping her with what she needs. And with arthritis and different issues that she has, having an electric toothbrush would really help with her limited mobility. So we want to incorporate that, make sure that she has that to her disposal, and getting her fluoride toothpaste as well for just strengthening that enamel. And then in terms of maintenance, we would do recall appointments when every 6 months or as needed if we need to increase or decrease that. And with the just appropriate proper denture care and those periodic radiographs to ensure that she is sustaining this health that we establish her with.
So we can see based on the need that Miss Staple has for assist that she has decreased mobility. So the first thing I'd want to do to assist with this is to provide her a front wheel walker, which she can obtain through her insurance at no cost. Using this will help to improve her balance and increase her independence with gait and transfers. And then that will in turn decrease the assist needed from her family. And it will also encourage more frequent ambulation. After providing this walker, I would provide gait and transfer training so she can use the device correctly and with proper sequencing. I'd also provide family training, including how to teach the family how to don a gait belt and how to properly assist Miss Staple in a way that's safe for both of them, which also includes teaching proper body mechanics to decrease any risk of injury to the family. I'd also provide a home exercise program that initially works on global lower extremity and core strengthening. This will help to help increase her ability to perform transfers and gait and help with her balance, and it will decrease any muscle atrophy. I'd also encourage more frequent ambulation, so that's a skill that she keeps up to improve her functional strength, mobility, and endurance. And then I'd also encourage frequent movement of her residual limb to prevent any contractures. And currently with the active infection, I can't do a whole lot in addressing her prosthetic, but once the infection's gone, we can focus on edema management through the use of an ACE wrap or a shrinker to decrease her swelling so that her residual limb can comfortably fit into her prosthetic.
So on her psychosocial component, what I would really want to do is address her feelings of hopelessness, frustration, and guilt, which are leading to signs of depression. And so that social isolation and the flood, it's exacerbating these feelings, leading to grief and general distress, especially with the loss of a family member, church friend, and then displacement from the home. So how I like to look at things as from a whole health perspective. And so this really is about empowerment. So it takes into account her self-care, professional care, and the community into a whole health perspective. And so, as we mentioned earlier, Ms. Staple prefers care in the home. And so something I would want to connect her with is home-based primary care with the VA. And what this can actually do is provide services in the home. So Devon, who is our medical specialist, mentioned cognitive behavioral therapy related to maybe some of those traumatic experiences, also targeting the depression. This is something that a psychologist could provide in home-based care. And then maximizing her strength-based factors, including spirituality and resilience. So if we piece out the social isolation and general distress, the first thing I would want to do is re-engage her with the church community. And we know that's difficult now because of those environmental factors. However, being able to highlight, are there any Bible verses or prayer rituals that can be used in the shelter? Are there other members or even members within her family that she could talk about church and prayer and rituals with? And then Georgie, as we know, is her pet who provides a lot of safety and comfort. And he's actually in his own shelter right now. And so connecting her with Georgie through photos, videos, even having an object that is special to him and her can strengthen that bond. And then having her know that he is safe, including maybe getting on an anti-anxiety medication in the shelter, might actually lead to her feeling better mood-wise. We know that mental health and flood or natural disasters have an impact on each other. So the Missouri Department of Mental Health, they actually include a section on disaster services that are specific to floods and can help her with low-cost care as well. So we know that Hank is providing the caregiver support, but we also want to make sure that his needs are prioritized as well, as we know that taking care of another can lead to burden on the caregiver. So the VA has caregiver support program. This is a lot of resources that are free, a lot of handouts that he can connect with. One of those is Annie for Veterans, which is actually a VA text messaging service that can provide breathing exercises, motivational messages, and stress management periodically throughout the day. The Senior Alliance includes a caregiver binder with different areas as well that focus on the caregiver. I also included some compensatory strategies that Hank and her children can also try to maximize independence and make sure that she feels like she's able to do what she wants to do by setting goals and activity scheduling, which is part of cognitive behavioral therapy.
So in conclusion, Ms. Staple currently has immediate and long-term needs, and we addressed which discipline would best address these needs. So just looking at her physical health and her comorbidities for long-term needs, and just environmental adaptation and functional support as examples for immediate needs.
Well, thank you guys for listening to our presentation. Here's our conclusion of a few of the challenges and the lessons learned and how we're going to move forward with it. Due to time, I won't go into it too much, but we just wanted to say thank you for participating and listening to our work.